Today's lecture is hemorrhoids, sometimes called piles. Most people who submitted this question to me were eager to know whether it was possible to totally cure them without any form of surgery. The short answer is no. In most cases, you'll require some form of surgical procedure. But then let's have some small background first. Hemorrhoids are basically swollen and inflamed veins within one's rectum and anus. They cause massive discomfort, including bleeding and pain. They are very common. There are three types of hemorrhoids based on their location. The first one are called internal hemorrhoids. These ones are found deep inside one's rectum. Usually, they cause a lot of bleeding, but rarely are they painful. In fact, as a general rule, all hemorrhoids found above a certain line we call the dentate line will not be painful because that place will not have any pain receptors. The second type are the external hemorrhoids. These ones are found in the skin under someone's anus, and in most cases, they will protrude out of the anus whenever someone goes to the toilet. Now, these ones will cause a lot of itching and in some cases bleeding, but in most cases, they will be very painful when a blood clot develops in one of those veins. The third type are basically an event. These ones we call them thrombosed hemorrhoids. So basically, you're having external hemorrhoids that have developed a blood clot within them. They will be purple or bluish in color and they will be extremely painful. In most cases, these are the ones that people come to hospital with. So what causes these hemorrhoids, or who is at risk? So basically, anything that increases pressure within that rectum area can cause these hemorrhoids. So overstraining, especially when you're in the toilet. Maybe you've been having chronic constipation for a very long time. This is very common in people who don't take enough water or people who are not having enough fiber or roughage in their diet. So you're avoiding the pumpkins, you're avoiding the cabbages. Then you have prolonged sitting in one place. You'll find this in pilots, you'll find this in long distance drivers, etc. Then anything that increases pressure within your abdomen. So pregnant ladies, as the baby develops within the uterus, grows bigger and bigger, pressure increases and you can easily get these hemorrhoids. Also people who get liver disease, liver cirrhosis, then you find that their abdomen is all distended with water after they have gotten that condition we call ascites. They also tend to get these hemorrhoids. You'll also find someone who has chronic cough a very long time. So if you keep coughing for a very long time, pressure inside your abdomen will rise and you might also end up with these hemorrhoids. You'll also find them in people who are lifting heavy weights. So people who go to the gym regularly and they keep lifting heavy weights, or people whose work is to lift heavy weights like Migugu in the taxi park, you're also at a high risk of getting these hemorrhoids. They will also be common in the elderly. So when you reach age 30, your risk increases, but then when you reach age 60, the risk is even higher. This is because your collagen and other connective tissues are getting weaker as you age. Lastly, let's discuss treatment or management. So management comes in two ways. We have one we call conservative, where we give you some things, not surgery, just to give you relief. Then we have definitive one, where we'll do the surgical procedures to totally cure these hemorrhoids.